Wonderful. So I'm Dr. Victoria Williamson. I'm a researcher at King's College London, the University of Oxford, and recently the University of Exeter. And I'm going to be talking about our research that looked at moral injury in veterinary professionals. So I can hear the question in the room, like, what is moral injury? So moral injury is a term used to describe the very intense, very profound distress that you can experience after an event that violates or challenges your moral or your ethical code. And moral injury can occur after a potentially morally injurious event, a PMIE. And PMIEs typically come in one of three flavors, if you like. So acts of commission, something that I did. As an example, say as a police officer, you use undue or quite a lot of force in detaining somebody. That may be an act of commission. An act of omission is where you stand by, you let it happen, you perhaps don't say anything or stop it. So to continue with that police metaphor, you witness your colleagues using quite a lot of force to detain somebody, and you just let it happen, and you don't stop it, you don't say anything. And then experiences of betrayal, and this is often but not always by somebody in a position of authority. And there's been a real explosion of research into moral injury lately, especially following the COVID-19 pandemic. There's a lot of work that's looked at moral injury in healthcare workers. But it's really important to stress that unlike post-traumatic stress disorder or PTSD, moral injury is not a mental illness. But these sorts of experiences can lead to the development of negative thoughts and beliefs about yourself, about other people, like my colleagues don't care about me, and like I'm a monster, and thoughts and guilt and shame and anger and disgust. And it's this that can lead to the development of mental health difficulties like depression, like post-traumatic stress disorder or PTSD, and suicidality, which is what we found in our meta-analysis. What we also found is that the vast majority of research at the time had been done in the US military, and it was quite unclear whether moral injury is a concern or a difficulty faced in the UK, but also by sort of civilian non-military populations. And we also know from the sort of broader literature that people who struggle after potentially morally injurious events, they can respond poorly to standardized PTSD treatments, which are very good at dealing with things and feelings of fear, but not so good at getting at things like guilt and shame and disgust. So there was a real gap that we identified, given what we know about the challenges that veterinary professionals can face in their line of work. We thought that it was possible that veterinary professionals might be exposed to potentially morally injurious events, but we didn't know what types of events these might be and what impact this might have on well-being. So we were really honored to receive the Sarah Brown grant to look at moral injury in veterinary professionals. And this all kicked off in January 2021, still kind of in the grips of the pandemic. And we were able to conduct this study using an anonymous online questionnaire where we explored quantitative measures of moral injury and mental health outcomes. And we also did telephone interviews and interviews via Microsoft Teams to really explore the lived experience of veterinary professionals. And we were very broad, so you could take part if you were a new grad, or if you were an old hand, or if you were a nurse or a practice manager or a vet. We were very inclusive in the study because we wanted to take a real exploratory approach. And I can't talk about everything today. I understand there's a very strict time limit, but if you're interested in reading a bit more about what we did and what we found, I hope that the QR codes will take you to the paper. But essentially, what we found was that moral injury is experienced by veterinary professionals here in the UK. We found that a significant proportion of our sample reported experiencing potentially morally injurious events. In our online survey, we found that acts of omission, so that the standing by, not intervening, and betrayal were the most frequently reported. And we found that exposure to potentially morally injurious events, it was significantly associated with symptoms of PTSD, especially amongst those kind of betrayal events, people reporting betrayal. And in the qualitative interviews, what we were able to really explore is people's experiences of having experienced an event like this, what impact it had on them, on their well-being, on their functioning, how they got on at work, how they got on at home, their relationships with other people, and their relationship with their self. And we found that people reported quite a wide range of potentially morally injurious events, and it was often sort of witnessing other people doing things such as witnessing or being involved and helping sort of senior colleagues having to euthanize healthy animals at an owner's request. People described having to carry out procedures that were perhaps beyond their own skill set or beyond their practices' capabilities to be able to bill the client rather than sending them to a specialist hospital. People also reported how they were involved in the 2001 foot and mouth outbreak and sort of the culling that took place. And that sort of experience really stayed with people for a number of years. But significantly, we found that a lot of people were reporting quite intense experiences of bullying and harassment, including racism and sexism and having very aggressive clients and your colleagues witnessing it, standing by and not doing anything to intervene. So that was all felt to be quite morally injurious. And we found that experiencing potentially morally injurious events did really impact people's well-being. As you can see in this quote here, our veterinary professionals who took part, they really described a loss of confidence, a lot of guilt, a lot of shame, a lot of anger, and a lot of anxiety as well. People who took part, they really described that after this event, they described themselves as very changed, like permanently changed after having had this experience. They were more anxious, they were more distrusting of other people. Particularly prevalent as well as if you were a new grad, if you were newly qualified, you felt like you couldn't deliver care without somebody supervising you. There was a lot of anxiety, or you took very extensive notes to be able to have something to back yourself up just in case you were challenged. This sort of sense of anxiety and loss of confidence was very profound. And to cope with the distress, veterinary professionals described, they left the practice as soon as they could. They left. They sought out other roles, other jobs with much more supportive mentoring, or they left veterinary medicine altogether. Some people also described that they actively sought out psychological treatment and support from a mental health provider, and this was felt to be really helpful. It provided them with a sort of confidential space to be able to say what had happened and how it's made them feel, and to get some sort of supportive coping strategies and advice. We were able as well to look at some potential risk factors for experiencing moral injury, and one of them in particular was a lack of social support. So if you felt like you had friends and family, but they didn't get it, they didn't work in this field, they didn't kind of they weren't on your level, if you like. They didn't understand. So getting support from places like Mind Matters was thought to be really useful. But if you faced things like concurrent stresses at the time of the event, so cancer, a divorce, death of a loved one, that was felt to add to your risk for experiencing moral injury as well. And the thing I'd like to really highlight as well is people described if you felt unprepared, if you felt untrained. There was a description that if you didn't get in university like enough or sufficient training for what it's like to deal with really difficult clients, what it's like to have those conversations and feel confident having those conversations, and you also didn't feel prepared for failure. You get told what the best gold standard is, but what happens if you do everything you can and it still doesn't work? So more training was felt to be something that would be really useful, training that frankly prepares you for the sorts of things that you might face. And it also really highlighted the importance of good mentoring, especially early on, and that might be really protective. So if I leave you with anything today, I know this is a bit of a whistle-stop tour, but what we found in this study is that moral injury is experienced by veterinary professionals here in the UK, that it's associated with poor mental health outcomes, And this study is just a starting point, but it shows us that something needs to be done. It's possible that if we design and co-produce training in university that prepares people, gives good psychological education, good coping strategies baked in, that you may be better able to cope going forwards. It's possible that we could design interventions after the event that would improve people's outcomes as well. But we have the opportunity with future research to develop better evidence-based support for our veterinary professionals. Thank you so much. All of our papers are on the website here, if you want to take a look.
Thank you very much. Let's join with me in waving. Thank you. So we have time for a question or two. Does anyone have any questions? One in the middle.
Hi, thanks. That was really interesting. How much of an impact do you think COVID had on the study? Because speaking to friends who were still in practice kind of through COVID, I think there were a lot of really COVID-specific things that would have potentially had a big impact. Did you kind of look into that as part of the study?
Yeah, that was something we were able to specifically ask about, like what impact has COVID had on your work, and sort of looking at that in sort of the context of moral injury. How are you looking after yourself? How has it affected your practice? So yeah, it wasn't something I had time to talk about today, but it is in the qualitative paper, yeah.
Just in front.
Thank you very much for that. Did you look at demographics to see if there were particular cohorts that were more likely to sustain moral injury than others?
Yeah, I think you make a really good point. But what we didn't find an association between age and moral injury, or sort of years of practice, or gender. So I think the sample is quite small, and it sort of suggests that we need to do quite a larger study of moral injury, because we find in other samples, for example, in healthcare workers, the big studies of 27,000 healthcare workers, we find that nurses are more likely to have moral injury, younger nurses. Those in sort of minority ethnic groups are more likely to have moral injury as well. But I think as our sample was small and perhaps not representative enough, but if we could do a really big study, that would give us a really good picture of what groups may be more likely to struggle after potentially morally injurious events.
Thank you.
Thank you. And just the last question here. Thank you.
Thank you for an excellent talk. I just wondered, just on what you were really talking about, was what engagement did you get from veterinary nurses?
I couldn't tell you off the top of my head, but I'm really happy to talk to you about it. We made a real point of trying to get interviews and a quantitative data from the online questionnaire across veterinary professionals. So it was really important to us to make sure that we heard from a range of people.
Thank you very much for your talk.